This is a conversation with my audiologist. A couple things that we talk about that I think are very interesting, and one thing that's really important for people just to know that a hearing test is just testing your ability to hear, but there's a whole nother level of this, which is how your brain processes what you hear, and that's auditory processing. I talk a lot about vision because of my own visual issues, and vision does play a very big part in how our bodies stand up, stabilize, and move in space. So and clarity is one thing, but how our brain uses what we're seeing and processes what we're seeing is another thing. And most issues are not clarity issues. Most issues with vision is how our brain is using our visual system. Well, the same thing can apply with auditory processing. Hearing is one thing, and then auditory processing is another thing. Obviously, I guess you would say they're related, but they're not the exact same thing, and so they're two distinct, different tests. So that's really important to realize. Also, hearing aids. If you do get hearing aids because you have some sort of hearing that needs to be addressed, hearing deficit, not all hearing aids are created the same. And in fact, your brain will hear differently with different types of hearing aids. So we talk about why generic hearing aids may not be the best idea. And we talk about hearing in general for health, stress, tension, because when you can't hear, tension levels are going to go up for you and people who have to talk to you. And then, and also how loss of hearing or hearing loss is also implicated or found to be correlated with cognitive decline, cognitive function, cognitive decline, like Alzheimer's and dementia. So hopefully you find this interesting.
Say that hearing is such an ignored sense and it affects everything. I mean, it affects your ability to localize, it affects your sense of balance, awareness.
Right.
Um, just it has cognitive effects, it affects the way that we process sound. We don't just hear with our ears, we hear with our brain. And
Correct.
there's all these changes that happen when you're not hearing the way that you're supposed to.
Right.
um,
Yeah.
your brain function changes,
Correct.
which affects everything else that you just kind of went through.
Correct.
Um, and your vestibular system is separate from hearing. Vestibular is your balance organ, which is part of the cochlea,
Mhm.
um, or the hearing nerve rather. Within the hearing nerve, I'll just show you my picture.
Okay.
Oh, here.
Right.
So basically, this is your ear, right?
Mhm.
And the sound comes in and it travels past the eardrum to the middle ear space and then to the cochlea, which is the hearing nerve.
Right.
In the hearing nerve, there's all these really tiny hair cells,
Mhm.
but there's also part of the hearing nerve is the semicircular canals right here.
Okay.
That's where your sense of balance comes from.
Okay.
Separate from that is how you hear.
So are
And
they
so
are they are they linked or no?
they're linked, but they're very separate systems.
Mhm.
So, if you had a blow to your head, for example, it could affect your vestibular system and affect your cochlea, the hearing nerve,
Mhm.
and affect the hair cells because it's all kind of bathed in this in fluid, and a trauma or a force could disrupt that fluid, damage the hair cells, rupture the organ. I
Mhm.
mean, there's lots of things that can happen, but basically, when that sound wave comes in, it moves the hair cell,
Mhm.
and when the hair cell moves, it then sends a nerve impulse to your brain, and your brain understands it as speech.
And is
And so,
the hair cells is the oh my gosh, what am I looking for? the, the thing that wiggles. Yeah.
yeah. So what happens is
Uh,
in the
the hearing
cochlea,
the eardrum. Is that what the eardrum is or no?
no.
Oh,
So
those are
the
different.
eardrum is at the end of the ear canal is your eardrum, which is a really thin piece of tissue,
Okay.
and behind it is the middle ear space.
Okay.
That's where if you had an ear infection or some stiffening of the bones in your middle ear, that's where that would occur behind your eardrum.
How do you get stiffening of the bones in the middle
That
ear?
would be a calcification. It's called otosclerosis. It's a disease of the middle ear. It
Okay.
happens more often in women because they make calcium,
Mhm.
because they lactate. And so the calcium can actually build up on these bones. and they're supposed to kind of move, and they hang from ligaments. And when they don't move properly, they disrupt the way that the sound is flowing to the hearing nerve and can cause a hearing loss. But basically, for the purpose of understanding how you hear, the sound comes in, it travels past the eardrum to the middle ear, and then to the cochlea, which is the hearing nerve. In the cochlea, all along here, are these tiny hair cells. And so when the hair cell moves, it sends the impulse to your brain, up the auditory pathway to your brain, and your brain understands it as speech. When you have hearing loss that's due to the damage of hair cells, the hair cells are literally bent over, and you need more volume or energy in order to pick it up and move it.
Interesting. So, okay, so more energy via volume.
Correct.
Is what that's,
so
got it.
Part of that problem is that when your hair cells are damaged, in the absence of hearing, you can actually have tinnitus, you can have ringing in the ear, you can have sense of imbalance if you're not hearing what's going on around you, you're just not aware.
Imbalance in the sense of little balance, or just like,
yeah, people, I think it's when you have hearing loss, you're at a threefold risk of falling than somebody who doesn't have hearing loss.
Okay,
because your sense of awareness in the world is off.
But is that separate from, because I'm always struggle to realize how that is linked to vestibular, or is somehow, would that particular situation be part of the vestibular system, or something else that can cause?
Not vestibular.
Not vestibular.
Vestibular system is part of our ear, right? It's the semicircular canals. And so the vestibular system is these three canals, okay? And in those canals, there's tiny crystals. They look like little rocks, believe it or not, that are in our ear.
Loose recently, apparently.
What?
My mother's got loose recently somehow, and she was having, like, when she reclines or goes to try to sleep, she starts to get dizzy. So something along those lines.
So in the vestibular system, there's tiny rocks, we'll call them, that are supposed to be in fixed positions. And when they get out of position, they can mess up your whole sense of equilibrium and balance. And you get an episode of vertigo, which is where the world is spinning. You feel like you're on a merry-go-round, which is very different than like, I got up and I'm like lightheaded. It's not that. Okay.
So I did experience it once, and it was terrifying.
Yeah. And so it's not uncommon when you change positions, like somebody may notice it when they're laying down and then they get up, or if they go to the hair salon and they put their head back and get their hair washed. And then they sit up really fast, that can cause vestibular dizziness. And in more extreme cases, you need to have those rocks repositioned through maneuvers that doctors and physical therapists can do to help reposition those crystals.
So, okay, so that is different than what you were talking about in terms of hearing loss leading to being a sense of not knowing where you are. So let's just talk about, so that's hard. Most people are not going to know. So they would say, well, who do I go to see if I'm dizzy? Do I go to an audiologist? Because it's hard to know. I don't even know which one is the realm of which type of specialty.
Yeah. So when you're dizzy and you have like an episode of vertigo, the best person to see is an ear, nose, and throat doctor who can actually diagnose you and sometimes treat you. They may want to do a hearing test as well. So often ear, nose, and throat doctors will have an audiologist on staff that they can do a test if it's appropriate to make sure that there's nothing else that's happening that they need to address.
So as an audiologist, how did you get into that field and have the amazing thing about Rhee is that she is very enthusiastic about her job, which is always good because you don't always see people with such enthusiasm. I see University of Michigan behind you.
Go Blue.
Go Blue. All right. So can you just briefly explain how you got into this field and your background is?
Sure. My journey to being a doctor of audiology is not straightforward. I went back to school, and I just was in the career world for a little while, not really loving what I was doing. And I was very fortunate to have a family friend who was an ear, nose, and throat doctor who introduced me to the profession. I have always loved helping people. That's kind of been something, even as a young child, I've loved talking to people and helping people. And the gift of going back to school and finding the profession of audiology is that I can actually help people in a real, tangible way that changes their lives. And it's a beautiful thing because people come to me all the time and they're struggling and frustrated, and their family members can't deal with them and constantly saying what, and just, ugh. And then we do a hearing test and we properly evaluate them. And once they're hearing better, it's like their life has changed, and their quality of life, their ability to interact with other people. So it's this gift, and it's pretty instantaneous for some people, where all of a sudden, like, they come from struggling, and then I fit them with hearing aids properly, and I talk to them and they're like, oh yeah, I can hear you.
Yeah.
And so it's a really amazing thing to be along for that journey with my patients and be able to help them. And I've had firsthand experience with hearing loss. My family members have had hearing loss where I've been able to change their lives through hearing better. My grandmother, who had hearing aids, she was one of my very first patients. And there's so much connection between hearing and brain function that being able to help people when it matters most, when they're younger, and improve that brain function, that it's an amazing thing to be able to give and help people. So I'm very enthusiastic about
Yeah,
hearing.
no, I am a testament to this. When I experienced her enthusiasm first time was last July, I believe. So almost a year. Oh no, yeah, definitely a year ago. Now I
Mm-hmm.
didn't know I had hearing loss. Okay, no clue. So, and we realized, and it was unilateral because I have my audiogram right here. For the most part, unilateral. I think I had normal age-related, slightly on the right side, and then on the left side, it was clearly different.
Mm-hmm.
And you don't normally see asymmetric hearing loss, is what you told me. But because of my experiences in my life, it almost kind of fits together. Like, so without going into that, but do most people know that they have hearing loss?
They know that in the back of their head, they may feel like people mumble, or signs are like, when you go to a noisy restaurant, it's really hard to hear, but oh, everybody has a hard time hearing.
Yeah.
When in fact, they didn't 10 years ago, or maybe their spouse mumbles, but they didn't mumble 10 years ago, or their grandkids mumble, or it's hard to hear on the phone. There's subtle changes for most people. So it's not like they walk around and one day they had perfect hearing and the next day they didn't, because then they'd run to the doctor.
Right.
But it's that gradual, subtle change of the hair cell function that amounts to this missing of sound. And they're often like critical sounds, like the S sound, for example, is one of the first sounds to go.
Is that
You
the
can
high?
see that on your audiogram. If
Yeah.
you want to hold it up, I can even point it out.
It's like
The
a little pen, but
there's Neil.
yeah.
So the S sounds, the F sounds, the TH sounds, those consonant sounds are so important for clarity, because if you can't hear the S in the word stop, it's all of a sudden it's top, shop, hop, pop, bop, and so forth. And your brain has to work harder to fill in it via the context. And when you can't, if you're like, what did they say? Or it's just too noisy, that's why I can't hear, when in fact they should hear. And their brain function is now changing. And there's, because of those subtle changes, their brain has to work harder. And there's now links between dementia and Alzheimer's because of those changes in your brain function because of your hearing.
So when you say brain function changes,
Mm-hmm.
is there a more specific way it changes that
Yeah, they're
Because people
gray
are like,
matter changes.
how does it change? So that people want to know, like, all right, you said it changed, but
So
like how? What's the mechanism of a change, and when? Why should I care? Besides, because they'll be like, well, maybe I don't. There's so many different reasons that Alzheimer's or dementia can happen. That people will say this will be like, well, I've heard so many different things. Because there's always, it could be vitamin D, it could be vitamin, like there's a million things that people will cite as the reason for one particular issue. And people get confused, like, all right, well, how do I know if it's just age related or if there's a hearing link? So what is not the evidence, but what is the experience of your field in relation to those types of cognitive disabilities?
You ask a great question. So about a little bit more than 10 years ago, there was a big study that came out of Johns Hopkins that first cited the connection between untreated hearing loss and dementia and Alzheimer's, and that link. They looked at two different populations of people, one who treated their hearing and one who didn't treat their hearing. And they found that those who had untreated hearing loss were much more at risk for developing dementia and Alzheimer's. And since that landmark study, there's been a lot of follow-up studies that are now looking at the brain function. They're not entirely clear where the changes are based on how we hear, except that they have made very clear links between untreated hearing loss and dementia. They're still actively studying it.
Okay.
But what happens is there's two parts of how we hear. There's the anatomical structure, like what I said, where the sound comes in, it travels to the hair cells, and the hair cells move.
And that's
But
that's what they're testing for a hearing test, correct?
right, that's what we're testing for a hearing test.
This is fascinating. This the whole the testing procedure.
And from there, there's a neurological component, right? From the moment that the hair cell moves, it sends a nerve impulse up the auditory pathway to your brain, and your brain then has to filter it and understands it as speech. And so in our office, we have a whole hear method that looks not just at the hair cell function, but how our brain then processes speech, because it can be very different. And when you have cognitive decline and hearing loss, the deprivation of sound to your brain can affect the way that you hear. Meaning, like in noisy situations, you may struggle even more to hear clearly. Separate, and sometimes it's even separate from hearing loss. But when you can't hear clearly, your brain changes, and even the way that you behave in the world changes. You may find that if you're not hearing clearly, you're like, forget it, I'm not going to go to that restaurant because I can't hear at that restaurant, even though they have great food. But
well, as someone who said tinnitus since I was 14, the amount of time, and it's maybe I need help with it from a counselor in some way. I've always thought about this. The amount of time I've spent thinking about tinnitus, usually when I'm alone and in a silent environment, let's be honest, but then also to avoid it getting worse, I had to kind of structure my social life in such a way that I could avoid certain places. And you don't realize, and there was the same thing with chronic pain that I experienced. I don't think they're not linked. You organize your life in a way to minimize the symptoms of whatever you're dealing with. And it isolates you and quite depresses you. So
depression is another big thing with hearing loss.
So
it changes your demeanor and all of those compounding effects.
Your personality.
It affects your brain.
Yeah, and I remember a lot of people, and there's people, because I've been involved in the salsa world for so long, and of course loud music is part of that. So what I would always pretty consciously do is I'd always stand as far away from the music as possible. But then people would look at me like, wow, he's a jerk. He doesn't talk to anybody. But they never understood what was going on in my mind, which was tension. And so people misjudge you
Mhm.
because they don't know what you're going through. And if they've never been through it, they just can't relate. They're like, what's that even loud? Like, it's so different for everybody in terms of how they experience music and loud noise. Like, to me, loud noise is just motorcycles, trucks, anything loud. I just don't want to be near it whatsoever. While other people are like, it's not even loud. What are you talking about? So I've always found that to be like, that's one of those things that you just don't realize how difficult it can be for people who have hearing loss, especially if it's untreated, how it affects
Mhm.
their behavior and their happiness simply because they have to isolate themselves or wall themselves off to try to control their environment.
Right. Just changing your behavior has effects on our overall health and our function.
Yeah.
And while hearing loss is linked to dementia and Alzheimer's, it's just a quality of life improvement that's so easy to accomplish when done correctly. Um, I can't even tell you how many people have come to me and they're like, wow, I can't believe I waited this long to do this when it was not a big deal. When done properly, and the HEAR method, as you know, it works because we evaluate not just your hearing, but we test you with like up to 4 different hearing aids from different manufacturers to look at your brain function in relation to which device is going to help you hear the most clearly in noise. And so when you put the whole package together, you're going to hear better. And it improves your quality of life. It improves your localization, your awareness of self.
Mhm.
It improves just so much. It has such a cascading effect.
So let's just talk about because this was fascinating. Well, actually, I want to ask one question. So do you ever find people with minimal hearing loss, but on the other hand, very different, but almost outsized comprehension issues compared to what their hearing loss really is, and vice versa? Someone who has a lot of hearing loss, but so how correlated is the hearing loss that you're measuring through a hearing test, and then the
Mhm.
when you sit with the different tests that I can't even remember, what did you just call it? The how
Our
you're
HEAR method.
yeah. What are they completely linked? Sometimes linked, usually linked, sometimes getting completely different results than you would expect.
Yeah, that's a great question. So again, talking about the structural, like when you have hearing loss, it's the damage to the hair cells. But then from there, it's all about how we auditorily process. It's called auditory processing. And the tests that we're doing are auditory processing evaluations, and they are not always linked. People can have an auditory processing deficit or difficulty and not have hearing loss.
Mm,
Or they can have both, or, it kind of goes any which way because it's how our brain functions.
okay.
But with auditory processing, it can present exactly like a hearing loss. I have patients that are adults and they don't have hearing loss, but they can't hear in social situations at all. And when we start to test them and look at how their auditory function is, their auditory ability to process,
Yeah.
they could be very severely impacted. And even those people, when we test them with hearing aids that are programmed just for a normal hearing loss,
Mm,
or no hearing loss rather, a hearing aid, the right hearing aid can actually improve the way that they hear in noise significantly
mm,
and make it much easier, because a lot of the hearing aids today that we work with, from the leading manufacturers like Oticon and Starkey and Widex and those big companies, they put so much into the research and development and noise reduction and the way that they process sound, and they each do it very differently.
yeah.
And when you look at how it helps somebody's brain function, hearing and noise, it can be very dramatic.
Mm.
Um,
I know from my own
so
experience, I was fascinated. So
yeah.
when I came back, because I decided I wanted to try hearing aids, uh,
Mhm.
so that was in February, I think. So you put me in the chamber, and the first hearing aid, or the first technology you tried me with, I guess,
Mhm.
I struggled big time. The
Mhm.
second one, it was so clear that I thought you had given me an easier test. And then the third one was an abomination. So
Right.
only with the second this is what was so fast. I legitimately thought you had given me a different test. Like, oh, he's so bad that we have to give him an easier test. But in reality, it was just the technology was different.
Mhm.
So that was the most amazing thing I've ever experienced. One of them. All right. Because I would have had no clue that your brain will hear differently with one technology rather than another. And then you think about all these generic hearing aids that are available for low cost, because it's not,
Mhm.
there is a cost investment. I mean, there's an investment in these things. But can you
Mhm.
just talk about that? Because that blew me away that you actually said, no, that was the same test. Because they did not sound like the same test at all.
So the way that we do our testing and part of that HEAR method, the proprietary HEAR method, because it works, there's really no way to know what the best hearing aid is for a patient unless you test. It does not matter what it says online. There is too much that goes into these hearing aids to even like understand it. And what even manufacturers don't realize is that it's such an individualized and personalized thing, our brains. No one else has your brain, Neil, for
Right?
sure.
Oh,
um,
a good thing.
but until you start testing to establish what the best hearing aid is, you could very easily just rely on someone saying, oh, this is the best hearing aid and these are the reasons why, and you fall into that trap. But unless you truly test, you saw the difference.
It was
They were
ridiculous.
all programmed exactly the same based on your audiogram, your hearing test.
Yeah.
And until you tested, the results were astounding for you. Like one was crappy and one was like, wait a minute, you just switched test for me.
Well, I think on at least, I think two of them, because we redid the test for me without anything
Mm-hmm.
later. And I think I
Mm-hmm.
tested almost better without anything than with the other two brains, I think,
Correct.
that was kind of interesting also. So
Right.
it is so individualized. I still can't get beyond that in a way that a hearing aid could then actually make my
Hearing worse.
processing worse if it's
Right.
not the
And
right
there's,
thing. No one's
again,
going to think that. Like,
no, they wouldn't think it, but it can happen. It doesn't always happen that way. But when you test somebody unaided, like in their normal state, in noise, you're going to get one score. And when you test them in noise with hearing aids, you can get a different score. And when people get hearing aids from Costco or anywhere, they're not taking the time to do the HEAR method and do the testing. And because of that, you're just rolling the dice.
yeah,
And you would, I mean, Neil, if you had gone to another place, they may have just said, oh, that Widex hearing aid is the best hearing aid for X, Y, and Z reason.
mhm.
And then you would have heard really horribly and would have hated them and never worn them and never used them or returned them.
Yeah.
I have a very low rate of people returning hearing aids because they already know that they're going to help them. They already have like the data in front of them. It's a very data driven process.
Yeah, so that was probably the most fascinating. Well, first of all, I didn't know I had hearing loss. It never even occurred to me that I did. So which means it could have been gradual, but because it was asymmetrical, we think there was. What would you think if someone like, because I know you theoretically there could be a medical condition behind this that I'm completely unaware of, but
Mhm.
if you see this type of thing in someone else, and there's no medical condition, you would think that there was some sort of incident, like a loud sound that occurred next to one. What
It
would
could have been your health history, right? Like, I mean, for you, I think it's separate from like the regular patients that I see who have asymmetry, where it could, if you can't attribute it to like an ear infections or some trauma or something in their health history, then yeah, you want to rule out, like you want to have a CAT scan or an MRI to rule out anything retrocochlear, meaning like past the point of the hair cells, where there could be a tumor or something that's disrupting the sounds or causing you not to hear. In your case, I do think it was a gradual change, or you wouldn't have, you know your body well enough and you're very in tune with it. And if it had been something sudden, you would have like ran to the doctor. It was probably a very gradual change. And that's that subtle change that like you go from maybe just not hearing as well as you should have or used to to those subtle changes where finally you start missing those high frequency consonants like the S, the TH, the F. And that's where it starts to affect our communication with other people.
See, I never felt like the interesting thing is I never felt that I struggled to understand people.
Mm-hmm.
And I know for me, the interesting thing, because it's like, what was my experience with my hearing aids? The one thing, like I always say, I hear birds more clearly, and I love birds. So I like nature sounds are more obvious to me. They were before, but now they're just enhanced. So, and I like hearing birds. So it's like I'm more aware of the birds sound. It's just louder, I guess. That's just, and when I take it out, it's kind of like a black hole for a little while until I adjust. So that's the main thing. But the other thing is that, and I don't think anything in my life is coincidental, is that when I'm listening to music, I hear instruments differently. And I feel like I'm hearing, there's so many songs that I'll listen to now and say, oh, I had no clue that's what they were saying. Like, oh, I didn't know they were saying that. And I don't know whether I don't know what that process is. Or maybe I was just passively listening to music without actually listening to what they were saying. But I used to spend a lot of time on certain songs, like, what is this guy saying? Like a lot of people did, because back when you didn't have the internet, you kind of like, oh, what are they? And sometimes singers
better rewind your mixtape.
Yeah. What's a mixtape? But but now it's just like there's been so many songs that I listen to now that I said, oh, I had no clue that's what he was saying, even though I've heard that song so many times in my life, but only now it's occurring to me what they're actually saying. But definitely, I feel like I do hear instruments differently.
Yeah, I question when you first developed hearing loss. This could have been something you've had all your life. The other thing that I wanted to mention is the tinnitus, the ringing in your ears. When people have tinnitus, it's very hard to understand tinnitus, and they're still studying it. They don't know what causes it. But when you have untreated hearing loss, most often it's the absence of that sound that your ear is supposed to be hearing that's causing the tinnitus. And so when you reintroduce sounds and start stimulating those hair cells again, the tinnitus actually gets better. It won't necessarily go away, but where there was an absence of sound, now there's a presence of sound. And in that presence, it reduces the ringing or that tinnitus. Yeah. And so a lot of my patients who come to me with hearing loss and tinnitus say right away that now that's not as much of an issue.
Here's a question. Untreated hearing loss that someone may have at a certain age, will it always necessarily get worse, or could it just stay like that, and not get any worse? What's the typical progression? I'm sure you see a lot of different things, but what is the typical progression?
So I'd like to bring out my crystal ball right now.
Yeah.
There is no typical progression, unfortunately, with age-related hearing loss. In my practice, we see our patients once they're diagnosed with hearing loss. Yeah. We test them once a year, and I see my patients every 4 months to make sure that their hearing aids are functioning properly and that there's been no change in their hearing. And we do a lot of stuff, but really the goal of those 4-month appointments and testing annually is just to monitor things and to start tracking it. Because often people will come to me and they'll have this, significant loss, but they never got their hearing tested until it was like pretty significant. So there's no way to know how long ago this happened to start charting it. So then we just start charting it moving forward. And some people it changes, some people it doesn't. It really just depends. There's just no way to know, unfortunately.
That's a good answer.
But we just know moving forward what their health history is going to be. And on occasion, when you come in, there's instances where somebody will say, oh, my hearing aid's not working or whatever. And I'll look at it and we test it. And I'm like, it's not your hearing aid. And we put them in the booth, and then there's been a sudden change. Mm-hmm. So staying on top of it and having a good working relationship with an audiologist is really important for your overall health.